Yes, and I got to figure out a way to blur this. So hello, sorry again.
Now it just looks like you're in Tuscany or something.
Right, that's what we're going for. I wish. Okay, so it looks like we're right at 1:03. So since I'm the late one, I'll go ahead and John, does it look like we have I was just kind of looking at our attendees today. Oh, good, we have Kathy. Okay, perfect. So I'll go ahead and just take a minute and welcome everyone. I hope you're all doing well. Sarah, we're so delighted to see you. I actually just got back from Tennessee, so my Tennessee sister. Anyway, we're just really, really happy that you're back, and you bring so much excitement and just expertise to the council. We're just, or to the council staff, we're just so happy to have you back and helping us with our committee.
Thank you for the warm welcome. You know, we are Tennessee girls, but I see that A on your shirt.
I know. I know. Don't judge me. This is my husband's shirt. So I know.
Roll Tide.
Well, I know. I got to be careful with that. I know it's a kind of a religion in the South. It's really
no.
scary.
That's hilarious, Jana. No, thank you for the warm welcome. It's good to be back, and I'm eager to help and learn about everything y'all have been working on. So, ready to dive in.
Awesome. Well, with that, actually, that kind of brings us to introductions. Do we have anyone new joining us this morning? I think we all know each other, but just wanted to take a minute and see if we have anyone new joining us today. Looks like Vajette just hopped on. Hi, Vajette. Okay. So I think with that, we'll go ahead and take a moment and ask the committee if, actually, do we have to do a formal call that we've started the committee? Do we have to do that, John?
I think you just say you're going to call the meeting to order.
Okay, we've just done that. There we go.
You're good.
Thanks.
You have a quorum. You have a quorum, Jana. You're fine.
Good deal. That's kind of what I was looking for earlier when I was looking at our list of attendees. So wanted to also take a minute and ask the group if you had a chance to review the December 12th meeting minutes.
I did.
Yes.
Wonderful.
Yep.
Okay, thanks, Vajette. We see your note that you're attending on your phone. No problem at all. Just pop any kind of communication in the chat if you need to. So with that, do we have any discussion? Do we have any edits or revisions to the meeting minutes from December 12th? If not, then I'll put it out here to the group to make a motion to accept the meeting minutes from December 12th.
I'll make a motion to accept the minutes from the meeting of December 12th. Got it.
Thanks, Mary.
I second.
Thanks, Kathy. Okay, perfect. The next item we have today is our review of our committee purpose, goals, and vision. So I'll just read through that quickly. That our group is the System Access and Navigation Committee. The work that we do is under goal number 5 in the 5-year work plan for the council. And our goal area is designed to enhance, strengthen, and expand access to accurate and user-friendly information and the services needed for people with intellectual and developmental disabilities to lead more self-determined lives. And we have 2 objectives that we're working on. And so with that, I will go ahead and move to our next agenda item, which is agenda item D. And I'm going to ask for John to go ahead and Sarah to go ahead and get us started with the committee staffing change.
All right. Well, as we were sort of talking about just a few moments ago, Sarah Roof has rejoined the council as our Director of Communications. Many of you probably had a chance to work with her when she was with ADDPC from, I think, 2016 or 2017 to 2021. We are delighted to have her back with us. And although I have been staffing this committee for, I think, about the last 8 or 9 months, Sarah is now going to take over as the primary staff liaison to the committee. So for the purposes of the projects and activities undertaken by this committee, she will be the primary source of contact or point of contact. And I will continue to be involved because, as we'll discuss later, we've got this bridging disability and aging project that we're going to be undertaking. But Sarah will be the day-to-day go-to for all of you. So Sarah, you want to say anything?
Sure. Thank you, John. Thank you, Jana. Yes, I am really ecstatic to rejoin the council staff. I have crossed paths with a few of you before. I know Mary and Kathy were on the council when I left in 2021. I spent some time in the behavioral health world, did some marketing for one of the big local providers that serve the community of adults who have behavioral health diagnoses and substance abuse issues, as well as being on access. So coming back into the council and learning about all the behavioral health work and crisis work that you've been working on has been very interesting. I'm happy to bring my little experience now being in that world to my role here. A lot has happened in the communications world in just 2.5 years. And so I'm excited to explore with you all ways to get the message out about council projects, grants, issues we care about in new and unique ways. You'll learn my philosophy is very much, I'm a big believer in a blend of old, kind of legacy ways of communicating, making sure everyone has the ability to learn what we're up to, and then new ways, whether that's, AI, whether that's, things with smartphones that are new and up and coming. So just please consider me a resource. I'm happy to serve this committee, and I've put my email in the chat if you don't have it already, and please reach out for anything you may need.
Thanks so much, Sarah. That's exciting. I am excited too about, I share your philosophy about, really making sure that we're paying attention to the legacy, kind of mediums for reaching out, as well as some of these new and exciting opportunities for that. So thank you for that. Amber wanted to give you an opportunity to share any updates on the Getting Started guide.
Yeah, quite a few changes I've made. So this is what the Getting Started guide looked like last time. We would have the list of common questions for each resource, and then it would go into just kind of a list of all the resources. But I was trying to think of a different way to do it because it's still kind of overwhelming with how it is right now. So I kind of switched it up and I made it more of a slideshow, which I think will be easier to integrate into the website later on. And it has a lot more, it's easier to read and navigate. So for example, if I have a child who I want to talk about volunteering with, I would click on the middle to high school tab, and I now have it situated into resources based on different types. So if I wanted my child to get involved in the community more, I can click on these, and then I now have resources that are more laid out and easier to read, and then I would just click on any of these to go to the resource. And when I'm done, I could either hit this button to go back to the K-12 resources, or I can, if I want a different resource, I can go back to the navigation and choose another option. Another example is transition to elderhood. If I have a child, an adult child who has developmental disabilities, And let's say I'm starting to get older and I need help caring for them. I could then say, okay, well, let's look at everyday living. I would click on that tab and there would be some resources there that could help me. So yeah, I kind of just restructured it so it's easier for people to navigate towards and probably a lot less overwhelming. Yeah.
Amber, I just want to say, you really listened to a lot of the feedback from our last meeting, and this absolutely is so much easier to navigate. I believe one of our members of the public, or maybe it was Ken, that made the comment at our last meeting about how it was, it would have been tricky to navigate in its previous format. So this is exciting. Mary, I see you've raised your hand.
Yeah, I was getting real excited about it also. Thank you. Because what it took it from overwhelming to, okay, what are my next, it's almost like this navigation page is what are my next, this lays out what are my issues, which one do I want to pick? And then you click on one of these and then it kind of spells out, these are my next decision points. Which one do I want to pick? And it makes it so much easier to zero in and focus to what it is that I need to work on next. So it's really, really improved. Thanks, Amber.
Thank you.
I wanted to open it up and give any others an opportunity to share any feedback. Kathy, thank you for the thumbs up. Amber, it looks like we're moving in the right direction.
Yeah, I really like it. Thank you. I know
Thank
it's
you.
a lot of work for you. And I like
Mhm.
the fact that you're thinking about, well, this is too cumbersome, so let's try this. Thank you so much for that.
Mhm. So I just was curious too, for our next steps, Amber, what kind of, what were you envisioning was kind of the next step with this?
I think the next steps would be trying to figure out how to incorporate the whole like sort of guide onto the website, because I know that's where we kind of want to end up.
Mhm.
I know we need to start maybe looking into that, but other than that, I think it's to a point where we can like kind of share it and then see how it works, see if people are able to have a good time using it or if they have any feedback.
I think that's a great point. Can I make a recommendation? And I'd love to hear from the rest of the committee, is it that we package it together from the committee and send it out to like a pilot group of stakeholders to provide some feedback in its pilot form. And then, and then we can kind of revisit it from there. I did have one other question. So this is two questions. How do we feel about that recommendation? And then second, Amber wanted to ask the question, how nimble is this to, if we wanted to add another category, would it be difficult to add another category if we got to a point where we felt like there was another one needed?
If we needed to add another category, it wouldn't be that difficult to do.
Okay.
I think having a group of individuals testing the system would be great. I think it'd be helpful if we'd come up with some guidance for them, like questions like for them to respond to after they've, and it could be in like a little brief survey or something, but how easy was it to navigate, what was missing, those kind of things. If we put it more in a survey format and gave it to them and they could just click on a button and respond to us, then we'd have the the information right there in one area instead of trying to collect it from each person that we asked to test the system. And would we have, Jana, could we have some of your parents test it out, or do you want us to suggest people we know to test it out?
I think we could do it both. I think we could absolutely send it out to parents. That's easy for us to do. And then I think it would be good to also send it to the self-advocacy, a couple of our self-advocacy community partners, to provide some feedback as well. So I think we could do it both ways. And John and Sarah, I don't know how, you know, who Amber could partner with over at the council to kind of operationalize that activity, or how we might envision that.
So regarding the survey, the end user testing,
Mm-hmm.
well,
Not to put you on the spot.
yeah, I'm open to anything that would be easy for you. One idea that you might be interested in as well, besides the self-advocacy groups and parent groups Jana mentioned, would be to, and again, this, I don't know, I'm still just 1 month in. I haven't been able to track everything down, but we did a pretty good job at tracking people who cold called and cold emailed us over a period of years. And a lot of them were moving to the state. A lot of them were the audience that this is for.
Mm-hmm.
And so if I can find that would be a rich group to like have test this out too, because we know they've been there, done that. But you could do a Google form, like do a survey style, like Kathy said. I'm happy to create one and give you edit access. That could be one way we do this. If you prefer, SurveyMonkey or something else, Microsoft Forms. Really, I don't know what you currently use to do this kind of surveying, but I'm open to anything, really. I'm a big believer in end user testing, so I like the direction we're going with this. Amber, do you have a goal of people? Like, I want, 25 people to test this out. I want to get feedback from 50 people. I mean, what's your goal?
I don't really have a goal. I think however many people are able to test it out would be great, but I didn't really have a set goal. For the survey though, I do have a feedback survey. Is that kind of what you're thinking of, or would you want like a separate survey for the test group?
Actually, that's right. There's already the feedback survey embedded in the tool. Yeah, let's go over there.
Oh, yeah, that's great. Yeah.
That's right.
Yeah.
So let's not reinvent the wheel. We could just use that.
Great.
So all we need is in our email to our testers is that, please, I guess we used to say try to break it, but
Mhm.
and at the end, please provide your feedback so that we can see where we might have to make some changes and see if it's worth it. But I think Sarah, what you're asking is we need a range of age groups too, especially for our elder care transition, so that, it's not just our young parents, but it's our older family members that need to try and look at this and break it, for lack of a better word.
Amber, did you have or talk with Susan Vorel about any of this for the youth transition piece?
I don't think I have yet, no.
Okay, I would definitely send it to her to have the youth transition one reviewed, please.
Okay.
That'll be real helpful.
Amber, do you have her contact information?
I might, but could you send it again, just in case?
Yeah. I just was looking that up for you.
have a question.
Oh, go ahead. Go ahead.
So you already anticipated one of my questions, Amber, which was how did you want to integrate this into the website? I'm still working on getting access to the website, but I expect that to happen soon. Making it a slideshow would definitely make it a lot easier. But I also know that if it's a slideshow, it may not be picked up the same way on search engine searches. It might, I'm not sure. So would you or someone else, or I can do this as well, be interested in creating like a blurb, just a paragraph full of the keywords you think people would be searching for, that this slide deck answers for them, like this tool answers for them?
Yeah, I could definitely do that. And then I could probably send the blurb to you and see if there's anything you think I should add.
Perfect. Yeah, you could probably write that in your sleep at this point. You could like ad lib it. That would be super
Yeah.
helpful.
And on this feedback survey that Amber is sharing on her screen right now, Sarah, just so you know, we did work on this quite a bit and provided Amber quite a bit of feedback for this to develop this particular tool. So I think it's getting at a lot of what we're looking for. And if you are successful in finding that listserv of folks that had reached out to the council in the past, that was from out of state, I'm sure that that's quite a cross section of populations, with a variety of different age groups that would be impacted by, that we're reaching out. So I think that would be great. And so I really think we've got some focus group folks already that we can, subject matter experts that we can already send this out to. And so maybe what we'll do is just, for the purposes of the notes too, we'll plan raising special kids, parents, we can send it out to them. If we can find that listserv, Sarah, that you were referring to, of folks that had reached out in the past. And then I know, Mary, you had also mentioned about what would be our target group for reaching out to some of the elder population that you were referring to, Mary?
I think that we're going to discover that as we get into the community of practice stuff, because well, Barb, you may have an idea of some of the folks in DD that we could send it out to. Because I remember you did a calculation one time about how many people there were in a certain age category, right?
I did. I can definitely think about that, maybe chat with Leah a little bit about how we can get that to the right folks.
Mm-hmm. And I think even Yumi can help us with that too.
So
But I think that's part of what we're going to be discovering over the next year, because that whole elder transition area, I think we're going to start to fill that in as we go along.
Yeah, Sarah, did you have your hand raised?
Yes, Mary, do you know of any upcoming events that are in person that we could collect info from the aging services community, where even if this was on an iPad, or like an iPad with the survey, an iPad with the slideshow, and you could like demo it in person, since that's like a newer community we're reaching out to, maybe not newer, but one that we don't have like a list ready to go?
I don't know of any. That doesn't mean there aren't some out there. Yumi, do you know of any?
You know, how about the listening session that the regional agency conducted, John, the older caregiver concerns that you guys have the listening session, the participants who came to that, do you have list access to those folks?
We do not have direct access to those participants, but if we reach back out to the Regional Center for Border Health in Yuma, they do have a record of who participated, and they may be able to get in contact with them.
Okay.
I know they wanted to keep things as confidential as possible, so people felt comfortable being open and honest in their responses. But they do know who attended, so we'll give it a shot.
Okay.
And then I can send some of the folks who participated in my aging and dementia training. You know, those folks who are family members, I can send that out to those group as well.
Great.
Okay. And reaching out to Susan at Diversability, that would give us that young adult voice. So I think we have a good cross section of folks we could get that sent out to. Yeah, Barb.
Well, and I was going to say, Yumi, are the aging and dementia, that virtual conference we had too, right, last year. So those were some
Yeah,
of
so we
the-
have that list. Yes, definitely.
Okay.
Okay. All right. So Amber, it sounds like we do have some good next steps planned. So we'll work together to get those lists culminated over for you, and then work with Sarah about kind of a blurb to add to the email and we can share that, and then we'll get that sent out. I'm sure that it would, do we think it's too ambitious that we send it out sooner, send it out sooner than later, and then we can kind of review some of the feedback either by email or during our next meeting? What do you guys think? Just to keep the momentum going. Awesome, Yumi. So I think the sooner, yeah, if we can get it out sooner than later, then we could, that'd be a goal for our next meeting, that we have some data to take a look at, and yeah, just keep this going forward.
Could we also add the Intertribal Council and see if they'll send it out to their community, so that maybe we get some feedback from Tribal Council on if this is helpful for them?
Excellent idea, Kathy. Okay. Amber, is there anything else that you need from us?
I think at this point I'm pretty good right now. I have a
Okay.
good list of next steps.
Fantastic. All right. Well, we appreciate you so much as always. And this is huge Herculean effort, but I feel like we're making wonderful progress. And Amber just, and Sarah, Kathy just shared the link to some contact information for the tribal council, the Intertribal Council. Do we have a person, actual person, Kathy, that you know of at the Intertribal Council right now?
No, I don't know anyone. I was trying to think if they've changed so often that I just don't know anybody right now there.
Okay.
I could try to find someone for you, though. I can do that for you. That way you'll have a name. I'll call and follow up on that. How about that?
That would be great. I think that would be helpful for Amber too,
Okay.
and Sarah. All right. Thank you, Amber. So I think for our next agenda item, thank you, John. we have some updates to hear from you regarding the Public Health Workforce Development Project.
Yes, we have a final report in from the Regional Center for Border Health in Yuma, which is the subcontractor to the Sonoran Center for Excellence in Disabilities, on this federally funded public health workforce development grant that was all part of, the special COVID funding that the council received, and blah blah blah. Talked about it a million times. We finally have a report in. I will tell you that there is a significant amount of work still to do on the report. A lot of it has to do with formatting. A lot of it has to do with cleaning up some of the writing in the report. And I want to be careful. I'm certainly not trying to disparage the folks at the Regional Center who put the report together, but there's a lot of editing still to do on it. But what I can share with you is that there were pretty significant findings from the report, and it essentially broke down into a few key areas. And all of these, they refer to them as thematic areas. The first being accessible and affordable access to healthcare services. One of the key issues they found in their focus groups was that too many individuals with disabilities and with IDD in particular, and their family members, find that getting timely access to healthcare, appropriate access to healthcare, and maybe most importantly, culturally informed and culturally sensitive access to healthcare is an uphill climb. And for a lot of them, they felt like it simply wasn't available for the individuals with disabilities they care for or who are members of their families. So that affordable and accessible access to healthcare is a key concern, and it only grows greater, of course, as people age and as their health status changes and in many cases declines. So that's an area of great need. Then, of course, housing and food security remains a big issue. This is further intensified when caregivers grow older and they become less able to give care. They may pass away. There's a lot of concern about where members are going to end up living, and will they have the resources necessary to ensure that they are able to eat, they are able to take care of themselves, they are able to have the supports necessary to live a decent life. We all know that, especially in areas like Tucson and the Phoenix area, the cost of housing, and well, Flagstaff obviously as well, the cost of housing is extraordinarily high. It is, in many cases, relatively speaking anyway, no less expensive in a lot of other areas. And there's just a shortage of affordable and accessible housing for people in many parts of the state, rural and urban. So that's a significant concern among people, and the safety of housing, the safety of neighborhoods, the safety of the communities in which they live is an additional factor in their thinking. So those kind of fold into this general topic of housing and food security. There is, of course, the issue of inclusion and civic engagement. Nobody wants to be simply abandoned to the couch to watch TV all day. People with disabilities and the people who are their caregivers want them to have robust civic lives. They want them to be involved in their communities, regardless of their age, to the extent that they're interested in being involved in their communities. So there's a lot of concern. That at any age, people with IDD are stigmatized and isolated from their communities. And we know that's the case, even though we know that it's also gotten better over the decades. The greater concern is that as people grow older, potentially more frail, less able to be as active as they were, it's simply going to be an easier choice to keep them at home, to keep them behind closed doors, and not to take them out into the community and find ways for them to stay involved. So that is something that both caregivers and individuals with IDD expressed as part of these focus groups. There's also the issue of legal services, whether guardianship is appropriate or other forms of self-determination or lack thereof, the estate planning, the financial planning that has to go along with aging, all of the advanced directives and other ancillary items that have to go into this legal services arena. Those are things that many families know nothing about. that they have no financial resources to cover, and as a result, they have grave concern about what's going to happen to those they provide care for once they're no longer able to be a caregiver. And this is less a concern among the individuals with IDD, in large part, I think, because they're often shielded from those financial and legal considerations. But for the caregivers themselves, these are very, very heavy issues, and ones that our system is not really well prepared to address. There's obviously guardianship, there are public fiduciaries, there are things like that. But when it comes to the more comprehensive planning for an individual's future, it's pretty spotty out there. Issues of transportation. We all know that even in larger metropolitan areas, transportation for people with disabilities can be a bit of a challenge. There are services, but they're often unreliable. They're sometimes inaccessible, and they're often unsafe. So there are concerns about all forms of transportation, whether it's walking, bicycling, public transportation. What are the things that are going to be available and safe for individuals with IDD as they grow older, and are they in areas where those things can be provided? Will other resources be necessary? If there is no public transportation, or if there's limited public transportation, what is the means for people to get to doctor's appointments, to get to church, to get to whatever their civic life may look like? Education, training, and economic opportunities. Now, obviously, as we grow older, all of us, I think, generally start looking toward retirement and maybe doing less in the way of education or employment. But for those who are just still in their adult years, they want to stay involved, they want to be educated, they want to be employed, many of them, up to the point at which they decide they no longer want to be and they'd like to retire. So there's a lot of concern about poor educational resources, poor education for a lot of folks with disabilities in many parts of the state, and then the lack of transition services or inconsistent, inadequate transition services as people transition into adulthood. And then what does transition look like when they do decide, as they reach their older years, when they do decide that they want to slow down? What are the programs and processes in place to help them do that in a way that doesn't simply cut them off immediately from their communities or from their peers who may continue working or continue to be involved in day programs or whatever the case may be? So a lot of concern about those things. And in fact, this one, the caregivers in the focus groups expressed more along the entire lifespan on this issue than any other, and is one that clearly is top of mind for a lot of these families, a lot of these caregivers. So those are the 6 areas that were determined to be the sort of thematic areas for this study. I will endeavor to have the final version of the report available to all of you by our next meeting. But as I said, there's still a lot of editing to do, and Marcy will back me up on this because she took a first look at it as well, and she provided me with a hard copy that had all kinds of writing and suggestions and so forth all over it. But I guess the long and short of it is, we got some great information out of it. We got some great insights, and we got dozens and dozens of quotes from focus group participants expressing exactly what's on their mind, telling their personal stories, telling why these issues matter to them, and sadly, in many cases, expressing their fears for what the future is going to look like. So I guess in an ironic way, that gives us a lot of ammunition. That gives us a lot with which we can work to build a better system, to make recommendations for policy changes, and hopefully meet these needs so that the fears these caregivers and individuals have are not realized in their personal lives. Happy to answer any questions if I can. I hope that's informative to you, Mary. I see you have your hand up.
Yeah, this is outstanding in terms of the summary. I love it. The good news is that this, I believe, matches point by point with what the aging community says their issues are. And so it almost gives us, I would suppose that something like this is going to be the outline that we say, this is what we want to explore. And you could have your agenda right there in terms of what the issues are. For both communities are the same. They're no different. So I think that's really good news because we probably won't have to spend a lot of time saying that our issues that we have in the disability community are not going to be a whole lot different than what you got in the aging community. So now what can we do to come together about it? So I'm real excited that this can be a platform to jump off of to move forward. So I'm thrilled with the report. So what you got, and thank you for summarizing it.
Absolutely, and you know, very much to your point, it fits so nicely with this community of practice work we're going to be doing. I don't want to jump the gun here. I don't want to dissuade anybody else from asking questions about the public health workforce project, but these findings, what you're saying, Mary, about how the aging community is essentially feeling the same concerns, it's such a great segue for us into the work that we're going to do on the community of practice, because it means that we're starting out on the same page, that we're not having to spend a lot of time identifying whose issues are what and which ones are the priorities. We pretty much know, I think, what the priorities are, and we can pretty quickly, I hope, build a course of action, a work plan based on the things we've just found out.
I also think, Amber, these might be perfect little boxes for where people can go to get answers. These identify what those issues are. Are you looking for more accessible, affordable healthcare? Click. This might be a good way to organize some of those things. Within that, I know you already have some organization to it, but these, if you don't have some of these in there, it would be good to have those in there.
Yeah.
Just add to that point too, that it's great that we have seen so much parallel to the aging community and the IDD, and then also maybe highlighting a key things that unique to the IDD and aging. For instance, that some of our folks may have some challenge with working with the public fiduciary when they no longer have family members, or some caregivers are out of state, supporting the individual in the state. So what are the roles and team of the support? And I think those are the kind of gray area we don't really address that. And I love to see how other states, are doing, addressing that part.
Well, and one of the strengths of this community of practice is that there are now 16 other states also doing this work, and there are about 8 states that have been doing it for the past several years. So we have some information we can draw from, and we'll be in contact with those other states to try and learn from them. We should be able to get a copy of, and I'm already diving into that, we should be able to get a copy of the work plans that they have put together, the priority areas they've identified, and how they're approaching this thing. So it could, we're not having to start from square one on this. We can borrow or steal from the good work that other people have been doing. Any other questions related to the Public Health Workforce Development project?
I just had a quick comment, John, because I know that you're going to jump into our agenda item E, but I wanted to just also reiterate the benefit of getting all of those personal stories. There is nothing that changes systems more efficiently and effectively than the power of a personal story. So I'm just delighted to hear that you got that there was robust feedback, and that that can really, really inspire some policy change. So I'm really happy to hear that. That's good news. So looking forward to hearing more about it.
And John, thanks for keep pushing on this project, because it wasn't easy to get through, but it's worth it. So thank you.
Oh, absolutely. And well, we all know, because we've been talking about it for the entire 2 years that I've been with the council, it did take a while to get it rolling. But it turned out that the Sonoran Center and the Regional Center for Border Health were fantastic partners in this. The folks in Yuma, I'm so impressed by their enthusiasm and their dedication to this, and they deserve a tremendous amount of gratitude on our part for pushing through, for being, I think, as comprehensive as they were. As you know, several of the focus groups were done entirely in Spanish. Several were done in English, and several were done in both English and Spanish, because they wanted to get a broad overview of perspectives. And I mean, I think we know at the council, because we hear this a lot, probably a lot of you do too, the Spanish-speaking population, the disability community that's primarily Spanish-speaking in Arizona, often feels underserved, often feels as though, even though nominally the services are meant to be the same, that you know, some animals are more equal than others, to use an overworked phrase. But they often feel left out in the cold. And one of the great things about this is a lot of the quotes we got were from people who are in that particular position. And to your point, Jana, about changing policy by telling personal stories, we really need to, and it's one of the things that we'll do with this community of practice work, we really need to bring home the multiplicity of perspectives, the variety of different points of view from different ethnic and cultural groups, from rural versus urban. We really need to identify and bring to people's attention how diverse the needs are in this state, and how there isn't always equity among the various audiences. So it's not, I'm not intending to point a finger at anybody. It's just kind of a reality that people feel. And so we need to address that. And we will do that. Any other questions on that project? Okay, shall I move on to the next item, Jenna? Okay, cool. So we've kind of buried the lead on this one a little bit, but we were accepted into the Bridging, it's actually Bridging Disability and Aging Networks. I put that backward on the, but it's the Bridging Disability and Aging Networks for Individuals with IDD Community of Practice. We were accepted. What they decided to do, they had 9 applications and 7 open slots this year, and they decided, through the approval of the Administration for Community Living, to accept all 9 applicants. So we now have a cohort of 17 groups rather than 15 who are doing this work in obviously 17 different states around the country. We had our initial call with the project facilitators from NACDD and ACL last week. And by the way, I want to particularly thank Barb Picone for helping organize this, and for making one of her staff available, Nicole Palomino, who is going to be sort of the co-lead on the project between ADDPC and DDD. We're gonna kind of try to keep things on track. The fortunate thing is we have lots of other organizations as well, both the Institute for Human Development and the Sonoran Center, Arizona Center for Disability Law or Disability Rights Arizona. Actually, I can show you right here. ADDPC, DDD, Division of Aging and Adult Services, the Arc of Tempe and its self-advocacy program at Arizona Achieve, Sonoran Center, apologies to Kelly, I somehow wrote Institute on Human Development instead of Institute for Human Development, but you know what I mean. The Arc of Arizona, Arizona Statewide Independent Living Council, ACDL, the Native Center for Disabilities at the University of Arizona, which is a project of the Sonoran Center. We also have gotten GANE, which is a program of Ideal Care. If you know Gabby Orozco, Gabby and Jose Orozco, they are service providers here in the Phoenix area, and they run a Spanish language support group called GANE, or abbreviated as GANE. They agreed to be involved. Arizona Caregiver Coalition and Pima Council on Aging, we don't have a firm commitment to them yet, but we do have, I think, a pretty good group of organizations involved, and we're still looking for more. We certainly would love to have wider variety of Native American groups, of Spanish speaking groups, or Hispanic representing groups. If there are other aging entities that we need to involve, we're looking for suggestions to get them involved. There's no requirement that we just stick with the group that has already been identified. So any suggestions you might have, we would certainly welcome. If there are any other AAAs, area agencies on aging that you have contact with that we should reach out to, please let us know. We chose Pima Council on Aging just because several of us had prior working relationship with them, and they're really fantastic to work with, and they've got all kinds of resources and are doing great work, and they seem to understand individuals with disabilities pretty well, which is a fantastic benefit. So please feel free to share any suggestions you have for others that we should get involved. Our next step is to have an initial meeting of the various partners on this project. Nicole from DDD and I are trying to identify dates that will work, and then we'll be sending out a communication to everyone with some potential dates, and we will then begin the process of putting our state plan together and moving forward from there. As far as the national facilitators go, we will have a monthly check-in call with them, and then every 6 months they would like to have a call with all of our partners involved, and we'll be arranging those as time goes by. We now have 3 years to work on this, 24, 25, and 26. And the expectation is that we will come up with a plan that leads to some specific outcomes, whether they be policy recommendations or activities that we all decide to engage in, but that the projects not end or the work not end at the end of 3 years. The goal really is to make this sustainable over the longer term. So we'll clearly be having some discussions about what will be involved in making sure that most or all of the partners can continue to do some form of this work after the community of practice grant ends. That is not a discussion that those aren't decisions that we've made already. Those will have to come as we move forward with the project. Mary?
Yeah, that's exciting. You guys have already done a lot of work so far. Thank you. I do have a few ideas of some other participants. I do, and so I'll just mention them, and then I'll send you some information about it. The Hospice of the Valley does, I believe I've heard that they have a person that is trying to specialize in hospice for people with intellectual disabilities. It's something like that in there. That would be perfect. And there's the lifelong learning that ASU has, the Ollie Center, I forget what the name of it is, but they have extensive ability to do the kind of education and stuff related to the aging community. And I would be interested to know if they'd be challenged to maybe explore working with people with disabilities in there also. They've got a variety of things going on. And then the other thing is the Foundation for Senior Living, which I believe is located in the Phoenix area, but I wouldn't be surprised if they had things around the state. Has an extensive network and are already have some intergenerational kinds of things going on with people with IDD and elder community. So, and I'll keep my brain going and feed you more information as it comes up. So.
Excellent. Thanks very much. Yeah, I know that Erica had some connection with FSL when she was with the council. So maybe I'll get in touch with her and find out who her contacts were there and see if we can build on that.
Dr. Hamilton had the ACL funding for supporting the IDD population for the dementia kind of capable care, but she's connected with the Hospice of the Valley.
Thank you.
Thank you, Amy. let me pop that in the chat too.
Barb, I'm going to put you on the spot. I
No.
is there anything from the DDD perspective that particularly leaps out at you on this project? Anything
No, you know, I haven't talked to Nicole about it. I love hearing the list of folks, and I love the idea about the hospice, especially as it relates to working with IDD. And no, I haven't, like I said, I haven't had a chance, Sean, to get an update from Nicole. I'm looking forward, though, to definitely hearing more about it and the progress that you all make. So.
Well, that's where things stand for right now. I'm sure we'll have more to share with you at our next meeting. And by then we will at least have had a first get together of all the project partners and hopefully have something of an outline of where we're going to go down the road.
Awesome. It's all good stuff. It's also very encouraging whenever we see things happening. You know, so many times we get I think Mary mentioned this at one of our last meetings. So many times we're involved in projects and it feels like they go on for so long and you don't really get to see some of the actual operationalizing of the work. And so this feels like a lot of things are aligning and we can definitely see some outcomes from this work. So thank you. Thank you, John. Does anyone have any more questions for John, clarifying questions before we move to our agenda item F? Okay. I'm seeing none. Agenda item F is our call to the public. Just want to take a moment, have anyone that's a member of the public have any questions or discussion? Okay. And hearing none there. That looks like it's bringing us all the way up to the top of the hour at 2 o'clock. So we did good, y'all. We got a lot done in an hour. And sorry for my dog. So I guess it's time for us to adjourn. Henry is telling us. So I'd like to make a motion for us to adjourn.
Jenna, I apologize. Could I interrupt for 1 second? Do we want to go ahead and schedule our next meeting now, or do we want to just do a doodle poll and see what people are available for?
Yeah, let's talk about that. Yeah, hi Henry. He's very vocal. I think what we could do is I'll defer to the group of if you'd like to go ahead and try to schedule a time now. I am open for that. I do not have something pressing that I have to hop off.
I'm good with that too.
I'm
Okay.
good with that.
All right, wonderful. Let's do that. John, help us out here. And Sarah.
Sarah, I'm going to let you take the lead on that.
Okay, showtime. Well, okay. Do we like afternoons? Is that our preferred time slot moving forward, or at least for this next one? That narrows it down a little bit. I can't see everybody, but speak now, hold your peace.
Yeah, the 1 o'clock time slot we've been pretty traditional with that time, I think, for our group.
Yeah, I think it works.
Fantastic. This is a monthly meetup. Is that correct?
No, the last meeting was December.
Quarterly.
Did you want to do quarterly, Jenna? Is that your preference, or do you want to go more frequently than that?
Well, I think if we decide to continue to meet quarterly, it gives us some time to get the survey out, and kind of culminate some data to be able to look at it by the time we meet again. So.
Okay. How do we feel about early June.
When's, would that be before the next council meeting, John?
Mhm.
No, the next council meeting is April 19th, and then we have a council meeting on June 21st.
Yeah, I guess that's what I was looking at. It's prior to the next
Oh, I
Not-
see.
coming one, but that one, yeah. So I think, did you just mention the 11th, Sarah?
No, but I can. How do we feel about the 11th?
Can we do week before or week later? It's on the AIDD meeting is on that week. I'd love to be on this. Sorry.
Oh,
I mean, if it's okay.
yeah.
That puts us at June 4 at 1 o'clock.
That
That's-
probably won't work. The IHD conference is
Conference. We could do that. We could look to the 18th.
Works for me.
That works for me.
Tuesday, June 18 at 1.
Mhm.
Great. Anybody who's not here today that should be, maybe even for the first time, member of the public, or I just want to make sure I'm inviting everyone that needs to.
I will send you the member list for the committee. So you'll have it.
Great, thank you, John.
Okay. So we decided on June 18th at 1 o'clock is when we'll meet again, and that'll give us some time to, get those surveys out and take a look at them. And then I'm sure, John, you'll also have some more feedback from the workforce development project. The report will probably be scrubbed and maybe looking good by then. And so, so with that, does anyone have anything else before we adjourn?
Mhm. Nope.
Okay, then I make a motion for us to go ahead and adjourn.
I second.
Beautiful. All right. Well, it looks like that's where we're at. So we're ready to.
Oh, I thought you said I move that we adjourn the meeting. This is Kathy. I'm sorry.
No, actually, Kathy, thank you. I think I did it wrong. So we need a second.
I'll second that.
Thank you, Mary. All right. Well, you guys have to and John, if you have a minute, I'd love to. I just need to ask you a quick question before we hang up.
You got it.
Bye, everyone.
Bye, everyone.
Everybody.
Take care. Hey, so quick question.
Yeah.
Wanted to circle back with you. We got a call from Leah over at DDD that is part of one of the supportive decision-making trainings. One of our RSK employees shared with you or shared within the training that they were hearing feedback that support coordinators were giving misinformation about supported decision making. So I wanted to kind of circle back with you about that. Do you recall kind of where that came from?
Well, I should clarify. I heard from Melanie Soto and Cy in that I heard it third. I mean, I heard it from them that somebody, and I think it was Carolyn Sossaman.
Okay.
Is it Sossaman?
Sostra.
Said to them, apparently there's rumors going around. I don't know if it was support coordinators who were giving that information or who it was. But Carolyn said, it seems like this rumor is going around. Is this information accurate? And they, of course, shared with her that it's not accurate, that supported decision making has nothing to do with the eligibility. And so I just mentioned to Leah when I met with her and Nicolette and a few others last week that this rumor was going around. I certainly didn't intend to say that support coordinators were saying it. What I asked them to do was make sure that support coordinators are informed that information is not accurate, and if anybody brings it up to them, they should correct it. if
Good.
any members or caregivers bring up, they should correct it.
Okay.
So, yeah. So no, I don't know if caregivers are spreading it. I don't know who's spreading the rumor, but
But it's a
Okay.
rumor nonetheless. And
Yeah.
so what I wanted, whenever I heard from Leah, I thought, oh, I want to make sure that I can touch base also with Carolyn to kind of, I'm going to drill in with her a little bit more to see where she heard that from. And then that way we can maybe even isolate it even more for Leah.
Yeah.
To see if it's a global thing that's being shared or if it's just kind of just one office is a little mistaken or what. So I just wanted to.
Okay. I think the context was that Carolyn was interviewing various people for her article
Yes.
in the newsletter, and I think, in fact, I just talked to Melanie earlier today, so I'm pretty sure that what happened was she